Research Institute, Vellore. It's mainly a community-based rehabilitation setup. After that, more than 15 years, I'm working in the field of school-based setup. So now I am very happy, or I'm able to give my feedback. I will be the happiest OT in working in school, because there are a lot of advantage and I'm enjoying that privilege. Okay, so today I want to share a few of my experience so that it will be helpful for you to grow in your career. Okay. To start my story, just I want to tell you from where to where OT has traveled. When I joined at an institution, so I was the only OT in the school. So I'm going to start my career in that place. So when I asked them where I can start, they showed me, they took me into a class. They took me into a class. In the classroom, one side, teacher, they are taking class. And they said that you use this one more corner for your occupational therapy. That is where our awareness was there. So that is where I started. I started my OT inside a classroom where teacher and students will be there, and I will be working in one corner. Slowly, it was developed. Actually, you can see this is the slowly it was developed into a small room, OT room. From here, now when I look back, the other picture which you are seeing is my present OT room, where where OT has grown into a different extreme. I have we have all the full-fledged OT equipments, and they know now the value of occupational therapy. So OT has traveled a very great path in the field of school. Okay, this is just for your encouragement. I'm just sharing this. When we talk about scope of practice in schools, it is very extensive. It is very extensive. You have a very extensive role to play as an occupational therapist in school. And since OT is more concerned with the development, we can offer much in school, since development or learning is the main occupation of the child. And we have a wider scope for early identification and intervention. And also I want to say that it's very lucrative. It will help you in all the aspect of your monetary thing. And also it is more rewarding. When you see your child, when you see children achieving a lot of things in your eyesight, you can feel. We cannot compare those things with other things, because in school setup, the children or the child will be in a long-term basis. In a long-term, the child will be in your supervision. So we can do a lot of things, and it will be more rewarding for an occupational therapist. Okay, so what are the scope of practice in schools? We can have a direct individual session, like we can pull the child from the classroom, we can allocate sessions, and we can have direct individual session. We can also have group session. We can have classroom observation and intervention. This is also very important. Teacher will be calling you to observe a particular child in the classroom and then give your suggestion. So we can take over that classroom observation, and we can give on-site intervention for the child inside the classroom. Parent sensitization and counseling. This is very, very important. In a very regular interval, you have to sensitize the parents and give them the counseling, because unless or until the parents are counseled on prognosis, you will be losing something. You will be hindered with something. Okay, so it's always very, very important for an occupational therapist to sensitize the parents what you're going to do, what is the prognosis the child is going to get, and you have to give a proper counseling from the time of assessment till the child is in your authority. You have to do a lot of sensitization to parents and do counseling. And empowering teachers and shadow teacher, that is also very important, because teachers and shadow teachers, they are more into a educational field and they have less experience on technical aspects. So as an occupational therapist, we have to do a lot of empowerment for teacher. We have to conduct a lot of training programs in a regular intervals for teachers and also for shadow teachers. As an occupational therapist, we will be involved in decision making. For example, promoting a child from one grade to other grade, or when it comes to the case conference, we will be involved in a lot of decision making skills. So these are all the main scopes of practice for occupational therapist in school. Yes, what are the challenges? Parents empowered with false hope. So like sometimes what happens, already they might have given, like somebody has given the false hope, and they will be coming with high expectation, and then it will be a difficult process in the therapy. So always you have to give a right hope, or you have to give a good direction to the parents. And sensitization of the management. You know, one thing, I can share one thing here. When I joined in a school, I asked for a swing. When I asked for the swing, nobody took it as a serious thing. Nobody took interest on that. And I was behind them to get a swing. To get a platform swing, I was trying like anything, because they are not sensitized with the need of the child, or they are not sensitized with the occupational therapy program. What is the need and what is the important aspect of child's need? They are not aware of those things. So now many schools, they are aware of occupational therapy and other things. This is just an example I'm saying. So we need to sensitize the management. What is the need? What the child needs? Why the child is behaving differently? Why the child is organizing himself differently? You are the responsible to sensitize the management and all the authorities in the setup. And sometimes huge caseload will be there, because now since our profession is growing, still there are limited occupational therapists in schools, and we need to address a huge caseload which will affect our handling and all. So these are all the few challenges we used to face when we work in a school setup. And what is the process? Like initially when a child is admitted, I want to say something here, because the process will differ from each organization and from each country to country. Okay, so whatever we are following, I'm just saying, when a child is admitted, as an occupational therapist, we have to do a small screening. We have to have a word with the parent, and we have to talk to the child, and we should have a small screening so that we can understand the nature and other background. Then we can go for an assessment. Assessment can happen in a natural setting like play area, playground, or other adjacent settings nearby school, as well as inside the therapy room and also inside the classroom. And also we have to do a very important thing, parent counseling. This is what I believe very, very much in this. You have to present the child to their parents. This is very, very important. Sometimes we fail to do that. We have to present the child, or we have to make the parent understand why the child is doing this, why the child is like this, or what is the organization skills, what is the present condition of the child to the parent. We have to do a lot of counseling initially after the assessment. And in a regular intervals, we'll be doing a case conference. Initially as a team, as an educational team, we will be having a case conference along with the psychologist, along with the speech therapist, physiotherapist, special educator, and counselors. We will be having a case conference after the assessment. And after that, we'll be setting a goal, and then therapy session starts. In a regular interval of 3 months, we used to review the prognosis, and then we will update the parents. And in the end of regular academic year, we will have a progress report meeting. Okay, so these are all the general process being involved in school-based occupational therapy. Okay, when it comes to assessment and therapy, I'm just telling you the common thing which I'm using, but it's always a child based. Whenever the need of the child varies, we have to go into a detailed specific assessment batteries. So commonly we will be using PDMS, Peabody, developmental motor scale 2, sensory profile, sensory processing measure, structured clinical observation, detailed developmental history, specific assessment batteries as per the child requirement. Here I want to mention about this one, the fourth one, structured clinical observation. In my practice, in my experience, I will recommend to all occupational therapists to have this important tool in your practice. Structured clinical observation will help you like anything. It will be your main core tool for your assessment. You can do wonders when you understand, when you do that right in the right way, you can understand the problem of the child, and then you can do a lot of things. It's mainly a sensory based sensory integration based assessment. So it will be a very, very important informal tool. It's not a very formal battery, but it's an informal tool. But when we use it correctly, it will be a very good tool to be used in our practice. Yes, this is what I'm saying. Structured clinical observation. First 3 tests, it is coming under neurological cerebellar integrity. So first 3 tests will be testing that cerebellar integrity, and all these actually there is a wide range of tests. I have given you some important things. Each one is having its own implication. So by using the structured clinical observation skills, we can identify what is the need of the child, where the child is having issue, and what is the treatment plan we can implement. Okay, so when we talk about individual educational plan, this is very, very important when we work in our school-based setup. Each child will be having a individual educational plan. So I will tell you what are all the main contents involved in this individual educational plan. First one is present level of or educational performance. We used to call that as PLOP. Okay, PLOP or PLEP. So this is one, and other one is we have to mainly this will be prepared by an educational person, special educator or the teacher. Okay, strength and weakness of the child, justification of the placement, like why we are putting the child in this KG1 or KG2, or why we are putting this child in vocational stream. We have to give our justification, and the data service will commence and terminate when we will start our program and when it is going to get terminated. List of persons responsible. Overall, the therapist going to be involved in this child therapy program, and criteria, evaluation process, schedules for determining, like for example, what are all the batteries, what are all the tools we are going to use, how frequently we are going to evaluate, all those things to be mentioned in IEP. And also we will be mentioning about accommodations with modifications. What are all the accommodations we are doing in the present it may be a curriculum, it may be a setup, it may be a physical setting, or sometimes if accommodation is not possible, then we have to go for a modification. We have to modify the setting, we have to modify the curriculum or the response things, and also a lot of accommodation and modification we have to mention in that individual educational plan. And annual and semi-annual goals, long-term goals, and objectives, benchmarks. We can call it as short-term goals we have to mention, and further recommendations and description of specific services child will require. For example, if in case the child needs a developmental pediatrician assessment, or if the child needs some important play therapy assessment or something like that, then we can mention that. Yes, this is a little bit relevant for all the occupational therapists. Just this will give you some idea how to set a goal when we work in a school-based setup. For example, this is a goal for organization of behavior, like for example, attention, concentration, sitting span. This will be coming under organization of behavior. So surely will demonstrate improved organization of behavior by ability to remain engaged in a self-selected goal-directed activity for 10 minutes with no more than 2 verbal prompts from therapist. So this is the goal, and we will be having the range of response, like where the child falls into it. So after 3 months, we can have a prognosis. Like for example, When a child is able to concentrate only for 6 minutes, or if the child is able to for 8 minutes, then we have to grade the goals, how much the child has acquired. So we have to grade the goals. So this is an example for in the area of organization of behavior, like attention, concentration, other things. And one more example is like, for example, in case of vestibular proprioceptive processing, we can write goal like this: Sam will demonstrate improved vestibular proprioceptive processing as evidenced by his ability to sustain his balance on a bolster or a platform swing during the movement-based goal-directed task while assuming kneeling position. We are very specific, and 80% of the time, okay? For example, if you're expecting the child to be on the swing for 10 minutes, at least for 8 minutes, the child should be on the swing and do the balance challenging activities. So then we can like grade the goals. And I want to give you a basic tips because a lot of students are there. So I want to give you a basic tips for this session. Like, always first you try to gain confidence of the parents. When you display your core knowledge and understanding of the therapy and other thing, the parents will get a confidence on you. So okay, so the important thing is you have to first gain the confidence of the parents. They have to have a confidence on you. Second one is develop a good rapport with the child. Sometimes we lack in that. First and foremost thing is to develop a good rapport. Rapport will bring a lot of change. First and foremost thing is not implementing everything whatever you learn. No, first priority is like mingle nicely with the child, develop a good rapport with the child. Then everything will fall in place. Whatever you're going to do, the child will be giving you a very good response. So that is very important. And cater the sensory needs. Many times the sensory needs are the reason for many behavior and other disorganization. Okay. So you have to do a detailed sensory integration assessment to understand the sensory processing difficulties and follow the developmental sequence. When you understand the developmental sequence, you can figure out where the child is. If the child is having problem in single leg standing, then you can start from single leg standing and you can progress toward hopping skills and other skills. So you have to find out where the child is there in the present developmental sequence. It may be a gross motor, it may be a fine motor, whatever the developmental area, you figure out where the child stands. And also attention concentration. Sometimes we used to think that attention concentration means always be on the tabletop activities. No, it also starts with gross motor activities. Okay, when the child is doing an animal walk for 10 minutes with the selected activity, then there the attention concentration starts. Okay, so always it is good to start attention concentration activities with gross motor activities. It will help as an occupational therapist to achieve the goals. And follow gross motor proximal stability activities prior to tabletop task. Okay, so as an occupational therapist, we focus on a lot of fine motor task and other fine things. Okay, so before going into fine motor task, we have to concentrate on our proximal stability of the child. So work on the core muscle group, like core muscle strength and proximal stability before going into the fine motor task or tabletop. Alter the activity to regain the interest. Sometimes no, we will be giving the same activity again and again, but try to alter it, try to change it with some kind of additions and subtractions so that the child will be interested. These are all the basic tips for the students. Okay, what are all the approaches we will be using when we work in a school-based setup? Personally, I am benefited out of all these approaches, so I'm just recommending this to you. There is a training called Handwriting Without Tears. Now it is called as Learning Without Tears. It is wonderful. As an occupational therapist, it gave me insight to understand the developmental sequence of writing, as well as the developmental sequence of fine motor and other things, where I can start, how differently I can give him the program. And there are a lot of standardized tools, assessment tools are there, lot of worksheets are there, which will be very, very helpful for occupational therapists when we work in a school-based setup. And also we all know about sensory integration for decade. for a past decade, we are talking about sensory integration, and we are all very familiar with the sensory integration. It will be our wonderful approach, which we will keep the OT always in a like in a high platform for children with sensory processing issues and other issues. And the postural correction and positioning, this is also very important. So we will be doing on site in the classroom, we will be doing, as well as at home, and what are all the applicable areas we will be doing that. And cognitive perceptual, also very important approach you will be using often. And also play therapy or play work, which I will throw some light on that. Yes, handwriting without tears will have a lot of materials in that also. So we can use it to gain the interest of the child, as well as it will be very, very helpful for addressing the need of the child. So personally, I feel this will be very good medium. And one more important thing is what I understand from this approach is it is based on developmental approach. Sometimes in the elementary school, they used to start with small case letters, like lowercase letters. Sometimes they will start in a different way, but the developmental sequence of teaching a letter is always a capital first and then lowercase. And even in the capital, there is a way to go. First, we can start with stick-based letters, and then we can go for curve-based letters, and then we can go for diagonal-based. So this is a very important insight I gained after going into the training of handwriting without tears. And it is having a lot of aids which will help you to implement your programs. Okay. And one of the thing is like wooden pieces will be used for many songs. Also we can use it for concept. We can use it for concept teaching, and we can use it for different things. We can use it. Okay, so the handwriting without tears will be having a very good aids to support the therapy program. Yes, when it comes to postural correction and positioning, this is a very common thing. Actually, she is a wheelchair bound child. When the OT was not there, they missed this important thing. See the position of the child. Already the child is having a cerebral palsy. The child is having a very she is more into diplegic. She is more into a diplegic, and she's having a very limited hand function also. Again, now what happens? There is a limitations in the positioning and position of the thing and all. So this is a very, very important area we have to address as an occupational therapist. So the ideal thing is, you all know about the basic positioning things. So hip and knee will be 90 degree, and the foot should be on the ground, and elbow should be on the table, and the good posture will solve the major of the problem. Okay, so this is one important thing we have to address. And the paper placement will be for a right-handed person, it will be tilted 45 degree, and for left-handed usually it will be a straight positioning, but for right-handed it will be tilted for 45 degree, and always the helping hand. Sometimes we leave this helping hand. Always the helping hand should be on the table, which will give a great support for the child, and other basic things you all know. And adapted seating, this one will help to address many issues. Like for example, the attention concentration issues and a lot of sensory issues will be addressed when you like, it depends upon the child. Okay, so when in a very when you know the child, then you can implement, or we can suggest this. When a child needs very frequent movement breaks, and when a child needs a lot of movement oriented activities to get focused, and these kind of adapted seating will help the child to remain focused in a given activity. Yes, I want to give you a small difference between play work and play therapy. Okay, play work means we will be having a goal. We will be having a designed goal and objectives, what we are going to do, what we are going to achieve from the child and all. So it's called mainly a play work, where we will be the implementing authority. We will try to bring the child towards the goal which we have framed. Okay, so we have the objectives and we will try to bring the child towards our goal. But when it comes to play therapy, the child will be the boss. It will be the child-based therapy where the child rapport is the very, very important strategy. First thing is, in play therapy, building up the rapport with the child is the priority. So when you build up the rapport, when you combine your interest with the child's interest, then a lot of things we can do. So in play therapy, the child will be the boss and the child will be doing a lot of things, and you will be a facilitator and you will be helping the child. Slowly you will be giving him a new things to play, and also it's mainly a child-centered way of things. So in our occupational therapy, we have to implement both of things. We have to implement play work strategies as well as play therapy strategies, and we should use a combination of these two strategies. Okay, I want to give you some kind of feedback on what we are doing. What I want to say here is these kind of boxes, these kind of enlarged way of doing things will help to do, or will help the child to understand the concept very easily. Sometimes what material we use is very, very important. So usually what will happen now, first we have to go into the shape copying and other things in a very, very enlarged way, very easy way, very simple way. And when the child gains confidence in that, then we can move into a little challenging aspect. Same way, now the child is copying the shape like it's a circle. Okay, so this one will help the child to get motivated, and also as a therapist, we will be motivated to move further. Okay, and one more thing I want to say. So here what happens, we enlarged the 4 lines. We just did a copycat of the basic 4 lines, but it's in a little enlarged way. These kind of simple modification will do a great help for a child to understand from where to where we can start, from red line, blue line, easy to understand. Okay, these kind of simple things will do a great impact. Okay, here I want to say is in European countries, this 2-line practice is there. This is also a very important thing. We have to go with the school, like whatever school is practicing, we have to like go along with them. But this 4 lines also is good, but at the same time, this 2 lines also will help the child to understand the concept very easily. 2-line concept. Okay, so I'm going to now conclude the meeting. This is what we do in the follow-up or progress meeting. We do the progress or review meeting every quarter, every once in 3 months, and we will review the goals and other things as a short-term goal. And we do the progress meeting at the end of the academic year. As a long-term goal, we will be reviewing the process and other things. Okay, so this is a follow-up and progress meeting we'll be having. I think I addressed the basic things. So this is where I put up my presentation. Okay, so here I conclude my presentation. This one, I feel it will be I feel that it will be more helpful for the students, where they can start your career in school-based setup. It is very, very, very impressive area to work with, and we can as an occupational therapist, we have a wide role, extensive role to contribute to the community. Okay, so thank you all for attending this. Yeah, yes, Arun.
Lavanya? Thank you, Joseph. Now the session is open for question and answering. So those who want to clarify your doubts, kindly introduce yourself, or you can post your message in chat box.
Sir, one question is,
Yes.
how different is essay approach and essay frame of reference?
SI approach and SI frame. SI both are same. SI frames of reference. It is basically on the SI sensor integration. That is what I understand. Sensor integration approach is like we will be understanding each and every processing, and then we will be dealing. Actually, there is a difference when we do normal sensory stimulation and sensor integration. Sometimes we will just misunderstand that giving some sensory stimulation, giving some tactile input to the child, and doing some sensory stimulation to the child is a sensory integration. Actually, sensory integration is, we have to understand how the processing is. And in sensory integration approach, we'll be using different tools also, like SIPT will be a very important tool to be implemented in sensory integration, where we will be assessing each and every area in sensory integration, like tactile and is motor imitations and tactile processing, and a lot of things are there. There are 17 subtests in SIPT, and this one will give a good insight to the therapist. But general stimulation, sensory stimulation will not come under sensory integration approach.
Sir, how OT
Yeah.
will tackle hyperactive autism kid in classroom?
Where is the question? Like once again, repeat the question.
How OT will tackle hyperactive autistic kid in classroom?
Yes, fine. So how the occupational therapist will tackle autism with hyperactivity in the classroom. Okay. So first we'll be doing a detailed assessment, and we will be understanding the sensory needs of the child. Okay. When we talk about autism, the way of communication is very, very important. The way of expression and communication is very, very important. So you have to use a visual cues or visual strategies to make the child understand the scenario, understand the environment, understand the things. So when it comes to a classroom, we will be using a lot of visual cues. We will be alerting the child what will come next. We will be going into the visual schedules and other things. Okay. And when it comes to hyperactivity also, then we have to have an extensive sensory integration program in an individual session also. But in case of classroom, again, it based on the child. If the child needs some kind of adapted seating in the classroom, which will help him to satisfy the movement-oriented activities. What is the main background of, what is the main reason for hyperactivity? Usually there will be a underlying sensory need will be there. Okay. So we have to understand the sensory need of the child, and then we have to address. Usually in a classroom setup, we can go for seating seat modification, like we can go for therapy ball seats and other kind of seat modification we can do. We can do a lot of schedules, visual schedules, we can use it, and we can keep it like in a right place for the child, and we can limit the number of students, and we can alter the environment by reducing the distractions. A lot of environmental strategies we can use. So these are all the basic things we can use for a child with autism and hyperactivity in a classroom.
Kindly, can you elaborate about play work?
Play work, yes. Sometimes, for example, we are doing one beats. Okay, we are expecting the child to do beading the lacing the beads. Okay, so this is activity. Our expectation is at least in another in a month or in a two weeks time, the child has to independently put 5 beats. Okay, that is our goal. So like this we will be having some kind of goal in play work, but it will be a playway method. We will be using playway method, but we will be having our goal in our mind, and we will try, even the child is going out of the way also, we will be trying to bring the child to do the activity in a different playway method. Okay, but what happens when you ask the when you expect the child to put the lacing, and if you give the beats to the child is throwing the beat, what you will do? The child is doing throwing and catching, throwing and catching, what you will do? So when the like we have to again understand the scenario. When a child is interested in auditory thing, the child will tap the beats on the thing. So like that, in a different way we have to assess it. And from there, for example, when we understand that there is an auditory need for the child, that is the strength of the child, then we can go into, like, for example, with the beats we can go for different beats, like beating, like 1 1 2 1 2 1 1 2, some kind of strategies we can follow, which will develop the rapport between you and your child. The child has auditory seeking, and the child is interested in auditory seeking, and you have developed this kind of sequencing and like this kind of musical way of using the beats. The child will develop rapport, and slowly you can go into the your pre-framed goal setting. Okay, so play work, basically you will be having your prayer goals for a child, and you will be trying to achieve those goals through play.
And then, can there be overlapping of roles between OTs and special educators in school setting?
Uh, there is a chance for that, but you have to be very clear in the roles. Like you should come to a common platform when we are having a case conference, or when we are having a group meetings. We have to come into a common understanding. For example, handwriting, hand function, all these areas will be addressed by OT, and mainly the educational way of teaching those things will be coming under special education. So this is mainly a common understanding we have to attain in a common platform. And as an occupation therapist, we need to help the special educator in many way, but also we have to we should know that where we have to stop, where we have to draw the boundaries. Okay, always there will be there, like there will be a role conflict, there will be a role overlap. It will be always addressed in a common platform by discussion.
So will brain gem exercise help classroom attention? If so, can you mention some of them?
Brain gym exercises, actually I don't have a very relevant research on that. Like I didn't implement those things for a long time, and I didn't find out, but I have some kind of hope in that. For example, the figure of 8, you know that figure of 8, there will be a figure like 8, and the child has to start with the C, like it's like figure of 8. This one will help in our because it will be involving both side of the brain, and also it will help the child to attain the good grasp, and the child will be touching the table with the thinner platform, thinner eminence. And so the figure of 8 will be a good strategy what I used in my session, which is giving a good result. And there are other strategies, but I didn't use extensively the brain gym activities. Only these figure of 8 was useful for me.
So one more question. How do you
Yeah.
make school or principal make aware the importance of occupation therapy in school setup, as many do not want occupation therapy in schools?
Yes. First thing is we have to work I don't know actually in which context. It always depends upon which context. Okay, if we have an entry in a school and the principal or the higher authority, they don't have much the knowledge in occupational therapy means, the first thing is we have to work with the child. We have to work with the parent. There is no need for the occupational therapist to talk, but the prognosis will talk through parents. The prognosis will talk through parents. When you work on child, the parents will talk to the authorities, and there will be a lot of feedback. Okay, so no need to worry much into the higher authority. When you give a good delivery, service delivery to the child, the parents will talk on behalf of occupational therapist. For example, you are denied entry to a particular school itself. You are not able to, you are not able to sensitize the particular school itself. Then what we'll do is we can whatever the way we get, like for example, there will be some kind of meetings. There will be annual meetings, annual teacher training programs will be there, annual management programs will be there. You can make use of that programs to have a short presentation. It should not be a very big presentation. It should be a short presentation where you have to show the difference. The child was like this before, and then the child was like this, and you have to show the difference, how it has impacted the child. Okay, this is how we can sensitize the management, but again it depends upon the context.
How long can we accept writing in autism children? How long we can expect writing in autistic children? Many deny pencil holding even though we improve sitting tolerance.
It is a very challenging, it is a very important question. It again depends. In my experience, when they are not willing to hold the pencil, don't force them. Don't compel them. There are different way of expression. You can go for typing skills, you can go for some other strategies, but when it comes to child with autism, the total scenario will be different. Like, we cannot compel them to do a writing things and all. The child will be verbal, the child will be understanding the expression. You can try with different things. It again depend upon the child's strength. The child will be very good in typing skills, or the child will be very good in other verbal skills. We have to go for an alternative strategy than pushing the child for writing.
Okay, Lavanya, I think the questions are over. You can go for the water tank.
I think questions are over, sir.
Okay, Lavanya. Water tank.
Sir, Arun sir, questions are over, I think so.
Yeah, water tanks.
Hello.
Yeah, you start. Water tanks.
Okay, sir. Okay. Okay, sir. Okay, sir. On behalf of my OT team, I convey my regards and heartfelt thanks to our esteemed speaker, Dr. Joseph Prabhu, sir, who spared the time for us and share his knowledge with us. We'd like to extend my thanks to all the participants for being with us. Thank you, one and all. Thank you, the technical team and students, for the continuous supports. Thank you so much once again to all the participants in behalf of OT team. Have a great to all. We'll come back with the next seminar with delightful topics. Thank you all. Thank you, Joseph, sir. Thank you, sir.
Thank you, OT team. I'm very happy to be in front of students after a long time. It is a very long time after that I was being in this platform. Very, very thank you to you all.